cancer does not care. But I think God does care. He was there for me in each hard conversation, quiet times, and sleepless nights of pain and distress.
We'll talk about a survivor story and the human side of cancer. Dr. Ahmed, please welcome on stage.
Thank you. Life isn't all about good times. Remember, none of us will get out of this alive. And if you know anything that I don't, please, I'd like to speak to you after this. We tend to avoid hard things in life that we try hard to dissociate ourselves from the idea entirely. Let me demonstrate by giving you a simple question. Your personal answer to a simple question: who dies? Look around you. Let me tell you who dies. Other people. The dark thought is that something that you probably have thought of but never shared. Something that is difficult to think of, but I had it. If you're sitting in this room breathing, the only people who die are other people. Not me, not you. And I thought the same. And I should have known better, being a physician, until I started becoming short of breath. So, exercise is my life. I exercise every day, up to 2 hours a day. And when I started becoming short of breath, this went on for 1 week, 2 weeks. Then at 3 weeks, I gave in to the advice of my physician to get some tests. Surprisingly, I have lung cancer, stage 4. Suddenly, the answer to the question had a different answer. Lung cancer is tough. It's invasive and it spreads. Just like a computer virus, it invades your computer without you knowing, and corrupts a file, and without you knowing, corrupting most of the files until your computer is dead. Similarly, lung cancer does not like to stay in one place, does not like to stay at home in the lungs. And it uses the bloodstream, lymphatics, to spread to different parts of the body. Until sooner or later, it becomes untreatable. Well, it used to be untreatable. And what I didn't know, and I was very happy to know, the power of genomics in the advancement of investigating and treating lung cancer. So doctors took a biopsy of my lung cancer, and it was found to be non-small cell carcinoma. And they did genomic analysis, and they found a gene mutation called ALK. And with that, the treatment was not chemotherapy that makes me ill and vomit, but rather by a pill that I would take once a day. And that pill has a funny name that I have difficulty really for me to remember. and has much less side effects. Now, what is happening with the battle against cancer is not unlike what happened in a battle against HIV/AIDS. In the 1990s, AIDS was the leading killer of young men. And with the discovery of antiretrovirals, the death sentence was demoted to a chronic disease, one which people can be treated into old age. And similarly, that is possible with some forms of cancer. So, I'm not saying my fight is over by any stretch. Cancer does not like to stay in one place, so it decided to spread to my brain. See, in my brain, it was resistant to the medication I was taking. Now, it was technically brain lung cancer cells, but it was in the brain as a different behavior and was not responding to my medication. So my doctor decided to change me into a different medication of the same family. Now, cancer could be, for instance, lung cancer could be really brain cancer, or the other way around, brain cancer could be lung cancer. So it depends on where these original cells had originated, and they decided to move elsewhere. Now, the treatment in the primary area, or either it's cancer or lung cancer or brain cancer, sometimes in the other location might not be as responsive or does not respond to the same treatment. In my case, they decided to give me radiotherapy. And that did reduce the cancer at the time. But then, it recurred in my abdomen. It invaded the adrenals, the paraortic lymph nodes, and they had to do surgery to remove it, laparotomy, and it was removed. And again, they switched my pills to a different medication of the same family. But cancer was still not satisfied. So it came back to my brain. Now, this time my neurosurgeon decided to do surgery. And they went on, and it was January this year, they removed 3 centimeters from the front of my brain. And surprisingly, I'm still here talking to you, missing part of my brain. So let me tell you a secret, I'm only using 10% of it. So the reason I'm talking to you here today is really because of what's happening, the advances that are happening in the research with cancer. So the cutting-edge technology is identifying the mutation inside the cell of each individual cancer and do genetic analysis and then try to personalize the treatment accordingly. So I recommend people who have cancer to search where the best treatment is being offered, best research is being offered. And in my case, I went to Boston, Massachusetts, Dana-Farber Center, where one of the leading centers in research in lung cancer. And there I learned that what my doctors were in Riyadh were doing perfectly well in treatment. Now, this is not guaranteed for all types of cancer, so it really depends on the center you're in. the type of cancer that you have. There are many people that have walked this path before. Try to find them and get some information that might be of help. I'd like to close by saying something obvious to all of you. Cancer is one of the most difficult things an individual could have. It makes you walk a thin rope of life and death. The knowledge that I might die makes me painfully let go of everything I always thought I would have and the things I would get to do. There is no drug cure for grief. And when the diagnosis is cancer, there is grief. It shows you how little you have control over your body. And that was difficult for me as a doctor, thinking that I do have control over my body. Exercise is my life. Exercise hours per day. How could death be knocking on my door? The answer is cancer does not care. But I think God does care. When something bigger than something bigger than me and bigger than something that I could apprehend, there was a room in me for Allah. Not just lip service. God becomes so real with me. And physicians need to know this when treating patients with such an incredible challenge. And I'm not preaching here. This was an important part of the process that I went through. Reaching a level of transcendence as hope is an important part of survival and healing. As nobody can be with you at every moment of trauma, God was there with me in every appointment, every procedure, and every surgery. He was there for me in each hard conversation, quiet times, and sleepless nights of pain and distress. He was there with me, supported me as I contemplated my new phase in my life and grew resilience and reinvented myself in whatever way, whatever days I have to be in His will. And for that, I am really grateful. He gave me the strength to let go of everything that I always have. Now, because of my cancer, I know that not only other people die, I know that I will die. What day? I don't know. But with God's help, I hope it's going to be many years, days in the future. Reaching peace is really great, is really a gift, is the greatest gift. And if you live like today is your last day, you will be truly living. Thank you so much and wish you a blessed day.